Hey there. Welcome to Counseling Stars for Students by Students, a podcast created with heart, purpose, and a whole lot of student passion. I'm Ash Savage. Thank you for joining us. Whether you're a fellow counseling student, a future clinician, or just someone who's interested in mental health, we're really glad that you're here. First off, what is Counseling Stars? At its core, Counseling Stars is a student led initiative. We're all about amplifying student voices and fostering real connection, advocating for accessible, quality mental health care. What better time than now? We're not just talking about the issues, we're living them, learning from them, and we're working together to make a difference. From collaborative podcast episodes to engaging social media content, cozy peer meetups to volunteer opportunities with real impact, we're doing it together. And it's all grounded in one simple truth: students supporting students make a difference. Let's break down what you can expect from Counseling Stars. So, first up, we've got our signature meetup series, Coffee and Countertransference. Think of it as a relaxed, come as you are space where students can gather over coffee, tea, whatever it is, water if it may be, to kind of unpack our course materials. We can vent about tough weeks. We can share our thoughts on mental health and basically just promote events, highlight resources, and connect. There's no pressure, there's no grades. We're just conversing and building community. It's peer support meets collaborative learning. We're also active on social media, so give us a follow. But because let's be real, that's where we live. You'll find us promoting our events, highlighting resources, sharing our thoughts on mental health advocacy. And if you're looking for inspiration, information, or just a quick scroll that doesn't make you feel worse, just follow us. And if you're interested or listening and thinking, this sounds like something that I want to be a part of, you totally can. That's the fantastic thing about Counseling Stars. We're for students, by students. We're always looking for volunteers, whether you're interested in podcasting, event planning, writing, or just lending a hand at a local event, mental health fair. There's a place for you here. And if you're listening and thinking, maybe that's not my place, maybe I want to be on the podcast, I think that it brings us to a good point where, of course, this is our podcast. And I'd love to introduce you to our co-host, our podcast coordinator, to introduce our podcast series, Amanda Sakurai.
Thanks for that introduction, Ash. When creating the Counseling Stars podcast, we wanted it to not only showcase the clinical mental health counseling master's program at OCU, but to also highlight key mental health resources and professionals in the field. We plan to have 2 different episode types throughout this podcast series. Stellar Pathways will feature short 15 to 20 minute episodes from the student perspective, offering a sort of inside look at the program. And these episodes aim to sort of demystify the process for prospective students and even those that are already enrolled. Constellation Features will present 45-minute survey-driven episodes like today's. Staying true to our mission, a podcast for students by students, we will explore the interests and curiosities of our fellow students in the program. These episodes will often feature guest professionals from the mental health field to discuss relevant topics in clinical mental health counseling, which brings us to our very first guest, who we have here with us today, Dr. Gina Wilson, Program Director of Oklahoma City University's Clinical Mental Health Counseling Program. And today she's here to share what makes the program stand out, who it's designed for, and also offer valuable insight. Dr. Wilson, you've been incredibly supportive in helping us create and launch the Counseling Stars podcast, and we're thrilled to have you here as our very first guest. Welcome.
Thank you so much for having me on your podcast. I'm incredibly honored to be your first guest and delighted to be here with you. What a great example this podcast serves as how student creativity and collaboration prospers in this program. You can be so proud of the work you're doing. I'm very proud of you.
Thank you.
Thank you.
So to start off, let's just get down to it. Can you tell us more about the clinical mental health counseling program at OCU?
Of course. It's one of my favorite topics. If I go too long, just give me a signal, pull on your ear, or give me the cut sign. I'll wind it down. Clinical mental health counseling program at Oklahoma City is a graduate level program designed to prepare students to become licensed professional counselors, LPCs. Our program's fully online and asynchronous, which means students can log on at their convenience or whenever their calendar and schedule allows to do the work they need to do and complete their coursework. But it's very far from being impersonal. We use a cohort model, meaning students come into the program together and move through the program together, often building lasting relationships and support systems amongst themselves that mirror the collaborative nature of the real world clinical work out there. In addition to the academic content, we place a strong emphasis on clinical skill development, multicultural competency, ethical decision making, and self-awareness, all of which are very essential for counseling professionals. Students in our program engage in intensive skills labs, practicum, which is a part of their field experience, and of course, internship experiences that bring them right into the community to apply what they've learned in real world settings, working with real clients under clinical supervision. Did I answer that well?
Absolutely. And I can attest to the cohort model. That's what brought us together to start this podcast. Getting to know and meet up virtually or in person has been wonderful and a really huge part of this experience. I will admit, a little hesitant when I saw it was all online, but I found it to be very engaging, and I was able to connect with all my other cohorts in a really easy way. So I love that.
Yeah, I actually agree. Yeah, I agree with that, Amanda. And it's something that for me, I work from home. I'm doing online school, and I didn't expect to, find the connection and be able to go with our cohort mates. And, we went to a conference together, and we're doing, a volunteer and Amy walk for mental health. And we meet up and talk about content, and we have group messages, and our instructors, not just our students, but our instructors are so available. And like, it seems like every time that, we have a initiative we want to talk about, or we have questions on the coursework, or, it just seems like there's that opportunity for it. There's really no barriers. And so that's definitely been something that I've really appreciated with the program thus far.
That's really fantastic to hear from you guys. I know counselor educators are not in this profession to get very wealthy. That's never the great outcome. And currently, myself and the teaching team all hold CACREP certified PhDs in counselor education and supervision. And I feel confident in speaking for each and every one of us that we are passionate about training counselors. And it sounds like that's coming through, and you guys are feeling that. So thank you for that feedback.
Absolutely. Thank you for sharing. And kind of to cue into the next question, what makes the clinical mental health counseling program at OCU unique from other programs out there, would you say?
Yes, that is a perfect segue to build on what we were just talking about. Thank you for that. So a few things set us apart. First of all, right now, at least, I personally review and approve every application that comes into this program. I do that with the intention of making sure each cohort is balanced and diverse and ready for the rigor of clinical training. I've seen the power of hand curating the student body to foster an environment of collaboration that we've been building on, mutual growth, curiosity, and professionalism. Second, we're not just checking boxes. Like you said, it's not impersonal. There are definitely ways we have built into our courses that are deeply intentional. For example, assignments, lectures, assessments, case studies, those are all embedded into the asynchronous learning platform. And that ensures a consistent experience and a high quality experience across cohorts, instructors, seasons. This frees up the instructors to focus on what you're talking about, being available, mentoring students, being present to give reflective and very personalized, individualized feedback. And third, I think is really important as well. We are innovative. We're integrating AI enhanced simulations into our clinical skills labs. This allows students to practice counseling techniques in low stakes environments with very realistic scenarios. And we're just getting started. The program's designed to evolve with the field, not follow it. So stay tuned. Any questions related to that?
I don't know that I necessarily have a question, but I do want to say the AI piece. It's something for me that initially I was a little hesitant just because I know I wasn't used to AI and I had never used it, and I think that's something that's actually been incredibly helpful and supportive in kind of practicing fostering our skill development because we're learning these advanced skills and techniques, and you're right, it's not always an opportunity. You don't always have an opportunity to have a real client in front of you, but the AI coursework that we use provides us kind of individualized feedback, and it's not necessarily it's not generic. It's very individualized. It's attuned to what we're doing. It seems to be, it's very effective. I notice throughout the semesters it becomes more and more simple and more kind of streamlined for us to meet with clients and have these sessions and really see our skills develop. So I actually enjoy it, but I was hesitant at first, I will admit. And then as far as our coursework goes, I think one thing that has been challenging for me in a good way, because, I'm big without, discomfort, you're not growing, right? You have to be a little uncomfortable. And the reflection journals, I think the reflective work that we do and self-assessment has been really, really, really meaningful to me, kind of learning my internal process, not just knowing what I'm doing, but understanding why and how it's affecting me. So I think that's something that's really huge.
Yeah, Dr.
Thank you
Wilson,
for that.
could you tell us more about the practitioner wellness model? I feel like this is kind of hitting on that reflective piece that Ash is saying.
Yes. In fact, how about we'll kind of we'll scaffold with that. So this question comes up a lot in terms of the difference between LPC, a licensed professional counselor, licensed clinical social worker, and a clinical psychologist. So how about if I start there and sort of parse that apart and then build on our part in that wellness model. Does that sound
Sounds
okay?
great. Yes, that sounds
Okay.
great.
Clinical psychologists, we'll start with them because they hold the highest degree in this set. They hold a doctoral degree, either a PhD or a PsyD, with a focus in their training on assessment, testing, um, very research oriented often. Psychologists are uniquely equipped to administer psychological evaluations. They often work with complex diagnostic cases. They're able to supervise other clinicians. And you'll find PsyD or PhD clinical psychologists either in academic settings or often medical settings. A licensed clinical social worker or LCSW holds a master's level degree, like you guys will hold, but theirs, of course, is from the social work background. They're clinically trained as therapists, but focus on systems and system level interventions. They are advocates. Their work is intertwined with advocating for social justice, addressing barriers to care, and working with underserved populations. They bring strong case management and resource coordination lens. We call their services often, they coordinate wraparound services. So they put a client in contact with as many community supports as possible. Traditionally, systems like hospitals will have an office for a social worker if that helps imagine the work of the social worker. So if someone comes into the hospital system um, malnourished or perhaps broken bones from abuse or whatever, they would be referred to the social worker who then sort of wraps their arms fully around that person and engaging all the services from the community that would be applicable for that person. So social workers are very, very important. And again, they're about that case management and community mental health in healthcare settings. LPCs, licensed professional counselors, is that what begins to set us apart is that foundational philosophy of the wellness model. What does that even mean? So, unlike the traditional medical or disease model that focuses on diagnosing the problem, the pathology, fancy word, and fixing what is broken, the wellness model is rooted in the idea that people are inherently capable of growth, healing, and transformation. So, as LPCs, we don't just look for what's wrong, we look for what's possible. We help clients tap into their strengths, build resilience, and reconnect with their sense of meaning and purpose. And those moments are transformative in our clients' lives and in ours. I'm a neurocounselor, and when we look in our clients' eyes and those moments happen, our brain changes a little too. But I'm going to put that to the side for now because I could talk for hours about that piece of our work. Very important. Um, our work is holistic. We look at the whole person. We look at the planet they're on, how it impacts their lived experience. We hold an empowering approach that I believe aligns beautifully with today's evolving understanding of mental health, the value of mental health services, and reducing the stigma to accessing mental health care. And we're all in a world that's increasingly burned out, disconnected, and seeking answers. And I would even go further to say, because I'm a clinician, I still work with clients, people are seeking meaning and purpose in their lives. Counselors trained under the wellness model are uniquely equipped to help people not only find their sense of meaning and purpose again, not only reduce the symptoms that they're suffering from, but to thrive in their life, in their lived experience. A licensed professional counselor again, is master's level, trained specifically in talk therapy, relational work, and clinical interventions. So we are on the front lines of mental health. We serve in private practices, schools, community agencies, integrated healthcare settings where we collaborate with prescribing providers, social workers, and other mental health professionals. And increasingly, we work not only in those settings, but in virtual platforms, providing services online. So that's exciting. The LPC role is rapidly expanding and growing in visibility and scope. Where we have parity in the marketplace now, which means we can bill for services that used to only be available for psychologists or psychiatric providers. A huge change, and we continue to evolve in that direction. So recently, another current change is now counselors can bill for Medicare and Medicaid services, opening up availability to that population for mental health services. So these are important areas of growth in our profession. So right now, let me back up just a little bit. As the demand for mental health care continues to grow nationwide, globally, LPCs are not just delivering counseling services. LPCs are stepping into leadership roles, influencing policy and procedure in the community places they work. And in innovative spaces like telehealth and AI-assisted counseling, it's an incredible time to be entering the field of counseling. A person that's interested in entering this field is not just filling a job, but they're stepping into a space where they can help shape what the future of mental health care looks like. While all three of those roles are essential to serve our community's populations, depending on the needs of the client or the community, and they often work collaboratively to provide the best care possible. And each path has its own strengths. But for students entering the field today, the LPC license is a dynamic, flexible, and increasingly powerful option. So I'd like to say to you and your colleagues out there, you're not just training to be a counselor, you're joining a movement that's reimagining how healthcare is delivered. And I think that's such an exciting and powerful position to be in. So thank you for giving me the spotlight to share a little bit about the passion of this field I've chosen.
That's one thing I notice is your passion. And I think that's something that's, it kind of, how do you say it? It comes to us, like we derive passion from your passion, and we're all kind of fostering that together and building on it. And that's one thing that's super exciting about, not just Counseling Stars, but also the podcast series, being able to connect and hear from voices in the field like yourself and really grow together. And I think that's super exciting.
Thank you for that. It is. It's very, very exciting.
I can see it in all of the professors that we worked with. They're really good about showing this as a model, this practitioner wellness model, and it is modeled, and it is really inspiring from Dr. Wilson to everybody that I've taken courses with. You can see them out there advocating and making changes, and it's really, really inspiring, and it's exciting to be a part of that movement, as you said. I think that was a really, really cool way to describe it.
Thank you for that. And it's right on time. You guys are right on time. You're right where you need to be. We need you. This is an important time for you to be here. So thank you.
Thank you.
Contagious. Y'all, I got it.
Contagious.
Fantastic. Yeah.
Absolutely. Are we getting more claps in there?
Yeah.
Or snaps. I like snaps too.
Yeah. Earlier, whenever Dr. Wilson was talking, I wanted to snap, but I didn't know.
Well, I think this is a good time to ask Dr. Wilson, what is your vision for the future of the clinical mental health counseling program?
Thank you so much for that question. Wow. When I saw the little ad for the position to be the new director of the program, it was the old psychology-based applied behavioral studies. And the university had kind of drafted the program on paper. They had an idea of going online. And I remember meeting with the dean in my interview, and I said to her on my way out, look, if I get the job or not, don't be afraid to go online. During the pandemic, even grandmothers learned how to TikTok. And the next thing I knew, I got a call. And they were like, come show us your vision for this program. My vision is bold. It's very bold, as you're experiencing. And it's also deeply personal. I do see this program as becoming a national model for how counselor education can be rigorous, inclusive, and future ready all at once. We are moving forward in the program. We're adding other relevant tracks. Like, for example, next up are a couple of telemental health electives that will also be offered to our community partners as a certification workshop. So I'm really excited about some of the directions we're headed. Currently, today, as you're a part of, we're building a pipeline of clinicians who are not only competent and ethical, but creative, collaborative, and compassionate. And I'm so very proud of that. So I'll continue working to expand our tracks to include specialties like integrated behavioral health care, school counseling, geriatric mental health, and other relevant topics that our communities need, because they do need diverse counselors who can serve them in diverse ways. The foundation of all of this is my firm belief that counselor education should mirror the kind of world we want to live in. One where people feel, you guys have heard me say this so many times already, feel seen, heard, understood, and respected. And I might add, maybe a gentle challenge to grow a little. So that means we can never stop. We have to continue pushing for innovation in teaching, strengthening our alumni network. You guys are doing great work with that. And continuing to form these valuable partnerships in the communities that our students will serve. So my vision is not just about producing more counselors. It's about cultivating leaders in this field of counseling who are ready to meet this moment and the next with clarity, purpose, and heart. Thank you.
Thank you so much. Ash, do you have any more questions to ask? I think that was like a beautiful way to end, especially I love that little heart that you gave there.
Honestly, I think that was a perfect end for, kind of what the program is, what the vision is. I think, I'm just impressed and excited for, future podcasts. And I think that, working together, having people feel seen, heard, understood, like those types of things are something that you can't go unsaid, right? And you can't understate the importance of those aspects. And I think that's something that our Counseling Stars initiative is fostering as well, and providing that opportunity to all of our students and people that are looking to get into the field. And that's something, Amanda, that I think that we have an opportunity here, right? And I want to make sure that everyone knows that they are welcome. Anyone can help us, anyone can join. as long as you're in the clinical mental health program, right? And so I'm kind of excited, Amanda, to hear like what are a couple of things coming up in our podcast series? Like what as our podcast coordinator, what type of discussions are we looking for? What can we hope to see in this?
Well, as I mentioned, there's two different types. The kind of the smaller form will be more from us, the students, and our experiences. So anywhere from the application process all the way to practicum process, which we haven't reached there yet, but kind of give potential students or people who are already in the program who just kind of want to hear what we've been experiencing and what's worked for us and what hasn't and what's excited us and what we're learning about. And then on the longer form episodes, we hope to have really great interviews with people like Dr. Wilson who are in the field doing the work and learn about the resources that exist out there and hear from the students as well. Anybody that wants to give us feedback or has curiosities that we can follow and explore together. I know we put out a survey for everybody in the program and we got some great feedback, and I think we have a lot to work off of and sort of go from there and reach out to mental health professionals or maybe other professors who are willing to speak on certain topics. And so I'm excited. Honestly, one of the big reasons I did this is I'm excited to learn more as well myself. And so I'm going to show up with curiosity and questions too. So even if you have questions you want to throw out there as well as a student, we will be more than happy to ask them if you're not necessarily interested in being on the podcast or anything like that. Like we want to raise everybody's voices and curiosities.
Thank you so much for that. I was just thinking how fun it would be. Maybe we could do a future podcast like Ask Me Anything and have callers. I don't know.
That's a great idea.
I love that. Yes. Like a live
anytime. I love to talk shop. I thank you so much for having me on. I'd come back anytime you ask me, I promise.
Thank you for taking the time to be here and speak with us.
Yes. This has been fun. I love the process. I think we're all growing together. That's the amazing thing. And we've talked about it in a couple of our meetings, but I believe, if I'm not getting it wrong, it's kind of act local, think global, right?
Mm-hmm.
Like
that's it.
We're going to be connected to Oklahoma City, connected to the community, improving, and providing access to quality mental health care. And then at the same time, like, Dr. Wilson, you said, like, our program is fully online for a reason, right? We want to make sure that we're growing and we're thinking global, not just in Oklahoma, because mental health is everywhere.
Let me plant this seed. When you publish this podcast, your voice could literally be heard around the world. You matter. Thank you both so much for doing this.
Thank you, Dr. Wilson.
Thank you. At the end of the day, Counseling Stars, for students, by students, it's about building something with each other and not just for each other. We're building it together. And we're here to create safe space where students can share their stories, support one another, step up as future leaders in mental health care. So if you're looking for connection, insight, or just a friendly voice that gets it, you've found your people. We are your people. Be sure to subscribe to our podcast. Follow us on socials. We'll put links in the description for our social media networks and accounts. And check out the next episode of Stellar Pathways. We've got some great conversations lined up. So until next time, keep learning, keep connecting, and keep showing up for yourself and others. Catch you soon.
Bye, everyone. Thank you.
Bye.